Hypovolemic shock is the next one we're going to start talking about. Anyways, hypovolemic shock is basically has to do with the vascular system and how much fluid is in there. So the idea is that we need a certain amount of fluid, which is basically what we're talking about is the blood in the system to help maintain perfusion, get blood to your brain so you can think and talk and act appropriately, to get all the nutrition to your organs, your oxygen and your glucose to make power so we can live. So there's a couple of reasons why hypovolemic shock happens, and some of the causes are, as you can see here, this gentleman has quite the uh, cut to his arm. So one of those things is external bleeding, internal bleeding, usually caused by trauma. Sometimes internal bleeding is caused by a medical condition, but the ones we're focusing on today for this part is basically trauma where you end up bleeding out or you have external bleeding or internal bleeding. Some of the things that we need to do. So we need to do supportive care with these people. We need like the oxygen, IV, if they need it. We need to maybe some fluid resuscitation to maintain that BP. But the biggest thing of everything that we're going to do is that we need to stop the bleeding. We need to immediately jump on that and get that. If it looks like a major bleed, like I'm not talking about like a scratch or an avulsion on the arm that's got some bleeding or some oozing. I'm talking about the ones where the blood is pooling. Again, you show up and go, ooh, geez, that looks bad. That might be something where you want to jump on it and do right away. That's a critical intervention that needs to be done right away. Even if you show up and then it looks like the person's in cardiac arrest, you want to stop the bleeding if they have a major bleed before you start cardiac arrest. Or you could do both if you have enough staff, enough hands to be able to pull that off, because it doesn't matter how much CPR you do if all the blood's laying on the ground. Some of the ways we can treat it, one of the big ones, first one is talking about, just doing direct pressure, right? Put a gloved hand over top of it, get the gauze on, get control and put a bunch of pressure. The next one is that a tourniquet on any limbs that is, you can't control the bleeding below where the injury is. And then if the wound's big enough, you might have to pack the wound as well. So when we're talking about treatment, this has been the trauma version, right? So people are bleeding out. This is the stuff that's kind of obvious that we can see. It's the ones that are pretty easy to treat. We also have to be aware of internal bleeding from trauma. If I get hit to the chest really hard with a baseball bat, I might have lacerations. If I go over the handlebars of my bicycle, right, and it turns just the right way, I might damage my spleen, which is going to bleed into my belly. And again, I can actually, if you have a high enough trauma mechanism of injury, if you fracture your pelvis, right, we have a lot of area that can, in your abdomen and your pelvis, that can fill up a lot of blood before it really shows any signs. So just be aware of that as well for hypovolemic shock. The other part, the second part of the hypovolemic shock part is the nausea, vomiting, and diarrhea. So this comes from, even if you look at someone that's doing a sport, like marathon runners, if it's really hot out, they'll get hypovolemic shock because they're going to sweat all that fluid out of their body, and they're going to become hypervolemic, they're going to become dehydrated. So this is the people that become dehydrated. And most of the time, it's when we see it, it's usually a lot of the time is because someone's been sick for a few days or even 24 hours if they had a severe gastric upset where they have a lot of nausea, vomiting with diarrhea. And in the summertime, especially around Alberta where we have winter and summer, but you'll see people who will perform sports and actually become dehydrated and get hypovolemic shock. So one of the things we talk about is the body has the ability, right? The vascular system, the container can actually squeeze. So if we drop a bit of fluid, it gets a little low, the body, it can squeeze it and then push it back up so we got adequate amount of blood. So, and then next, it can keep restricting it, but what happens is this is your adequate perfusion. But even though if you squeeze it because you've lost a lot of fluids, whether it's sweat, fluids through diarrhea or vomiting, or just you've bled out a lot, like someone stuck you with a knife and you didn't plug it right away. So you can see where this blood needs to be higher, so we have to just be aware of that. So some of the things we're going to do, supportive care is always the number one thing. Stop the bleeding. If it looks critical, that's one of the first things you have to do, stop the bleeding right away, plug the hole. If they're been sick for a few days or dehydrated, we're going to look at fluid replacement if you're within your scope, and if you actually carry some type of antiemetic where you can help them with if they actually have severe nausea with vomiting, you might want to give them an antiemetic to help them stop vomiting. All right, so that is hypervolemic shock. So let's go take a look at shock blocks, all our blocks, and see how that works. All right, so we got everything in line here, right? So what's happening here is that, I'll maybe pick a red one. right? The container block, it's bleeding. A lot of blood's going out. It could be fluid as well, right? Maybe, I don't know if that looks like a lot of fluid. And the next thing we're going to do is this block's going to pull over a little bit. And what's going to have to happen is to maintain this, the rest of the blocks, right? We're going to increase respiratory drive. So increase respiratory. We're going to have to increase heart rate. And the body's going to signal all the way down and get the signals back and forth and try to maintain this. The more that we bleed out, the more empty this container gets, the more trouble we're going to have. So if you think about it, you take this block and move it way out over here, this whole system becomes unstable. Now the heart doesn't have enough blood, right, to pump. If it doesn't have enough fluid in the body, you don't have to maintain. If it doesn't have the actual vehicle, it's like the Amazon Prime vehicle coming in. If you don't have enough courier wagons to get that blood and oxygen and nutrients in that system to all the cells and organs, there's nothing for it to pump. It even doesn't matter, get to the dispatch center, it's not going to be able to pump. Now there's no blood to pump, which carries the hemoglobin. It's what it attaches to. So now we've lost that as well. And because again, we lost hemoglobin, we've lost oxygen, and now because we're having trouble probably moving glucose, we're going to have something wrong with the brain. So we got to start thinking about how we're going to treat those. And like one of the biggest things is that originally, if we just stop the bleeding right away, as soon as we know there's a bad bleed, we stop that bleeding, and then we're going to be able to push most of these blocks back into place. Anyways, that's it for hypovolemic shock. Remember, there's two things about hypovolemic shock. There's the trauma version of it where you end up bleeding out and lose a lot of blood and fluid from your body that way. And then there's the one where there's an illness where dehydration happens because of nausea and vomiting, poor oral intake of fluids and food as well. And then there's those that we also make sure that we stabilize those as well and be aware of that. All right, we'll see you in the next shock.